And
There we go.
okay, so I would like first to thank the organizing committee for the opportunity to be here. My name is Gisela Tunes, and I'm a professor at in the Department of Statistics at University of São Paulo here in Brazil. I am here representing the Brazilian Statistical Association, which is the sponsor of the session. The Brazilian Statistical Association has recently created a committee on gender, race, and diversity, which I am very proud to be part of. And the aim of this committee is propose actions for promoting gender and racial equity and reducing inequalities. This section here at IDWSDS was one of the first sections of this committee, so thank you very much for the organizing committee and especially Ligia for the invitation. For this session, we invited 3 statisticians from different universities in Brazil to present some gender statistics in education and health that reflects the situation of women in Brazil. We also want to discuss problems and challenges women are facing, especially in math-related areas. Our first speaker is Reneta Guerra, and she brings us the results of a study with undergraduate students in Brazil. Reneta Guerra is an assistant professor in the Department of Statistics in the Universidade Federal de Santa Maria, Federal University of Santa Maria, which is in the very south of Brazil. She was in Italy this year and last year as a visiting research at the telecommunications and remote sensing laboratory. And she has won recently the Jan Tinbergen Awards Division A of the International Statistics Institute, and also the 6th call of the Serrapilheira Institute, which is an institute here in Brazil. So congratulations, Renata, for this. Her research interests include data science, distribution theory, econometrics, dynamic models, and statistical signal processing. So, Renata, you can share your screen and start your presentation. While she was here, just before I started talking, she probably had some problem with her connection. Actually, Renata is in Colombia right now.
Hi, can you hear me?
Yes, we can.
Okay, I will share my screen. I'm sorry, I had, okay, 1 minute. Can you see the presentation at the screen? Is it working? Can someone?
Yes, yes, you can. Yes,
okay.
we can.
Okay, thank you. Good hello to everybody. I was going to say good afternoon, but I don't know what time is where you are. So hello. Thank you, Gisela, for the invitation and also for this introduction. I'd like to start mentioning that I am here representing a working group from the Brazilian Societies of Mathematics, Applied and Computational Mathematics and Statistics. Our group is have people from these 3 societies, and we work for collecting some information about the profile of undergraduate students from these three areas. The idea was to unite our efforts to understand some questions related to women underrepresentation in Brazil. We focused at this study, I'm gonna present focused on undergraduate courses of these three areas. And our idea is, okay, we know that there is this underrepresentation, but how does it work over the time? And is it getting better or worse? So in this contest, our data is from 2009 to 2019. We collected information from the Brazilian Census of undergraduation. So we have this INEP institution which collects information from all the universities and in higher institutions related with that provide undergraduate courses. And from this census, we selected some variables of interest and filtered the courses and the students that started or graduated their courses in the census year. So we had 10 different census, 11 actually, and the information we collected is for each census. We had to do this separately, and then at the end create a final data set with all this information. It was made with the help of a junior company called Sigma Junior from the Federal University of Santa Maria, where I also work. Among the variables selected, we have those in this table. Here, I will not present the results of all these variables because of the time, but in this presentation, we are gonna see some insights about the year of the evolution over the years, the status of the students. So we have incoming students and graduated for each year. Also, the course area divided into mathematics, applied and computational mathematics, mathematics education, and statistics. Also, the gender and race. And I'm gonna also bring some information about the course type between bachelor and the teaching courses. To understand, have a general idea about the dimension of these courses, here we have the number of students in each situation. Most of the students are in the mathematics teacher training. They are around 90% of all the students for both incoming and undergraduate groups. And also another interesting thing here is to note that the incoming group is always higher than the graduated. The graduated has around 1/3 the size of the incoming. After that, we can go to the results about the gender disparity. This first, here, the results I bring are related to an explanatory analysis. So our idea was really to see the data and understand how it behaves over time. About the income, we can see for both groups, incoming and graduate, we have inequity, so women are underrepresented. And one curious thing is that for the incoming group, we have a smaller proportion of female than from the graduated group. Regarding the race, here we have a bar plot with this distribution. One interesting thing here is to note that the not declared and unknown groups are getting smaller over the time, especially from 2014. It's because in Brazil we had the census had a change in the way they collect the information. They asked it to the universities and higher education institutions to collect this information, so they could not answer the census without this option. So the not declared are getting smaller over the years because it's not possible to use this category anymore, the unknown, sorry. So one interesting thing here is the importance for the people who collect this information, like the responsible for the census in the countries, to pay attention to the way the data is collected, because there are some techniques that can reduce the unknown data. It's what happened here. One other interesting thing from this plot is to note the Black racial category is small for both income and graduated group, and even with the unknown situation getting better over the years, the proportion for this category is a similar behavior. In the next plot, we have the gender distribution by race. Here, I took off the unknown and not declared because I think it's more interesting to look for the ones who declared the race. And we can see that the female underrepresentation is common for all the races. But for the indigenous, it's the class with more disparity, and the second class with more disparity is for the Black racial category. Regarding the gender distribution by academic degree, the bachelor and teaching, we have the bachelor and teaching academic degrees. So we can see that the teaching academic degree is more equal than the female. And it's interesting to note because if we go to the first table, I will come back just for a few seconds, we can see that the teacher training is the more frequent category. So this higher frequency reflects in the proportions. So when we look to the general gender distribution, it seems that they are equal, but when we go to the academic degree, we see that we can note that it happens because we have a more equal situation for teaching courses, and then from the bachelor's, and since the teaching courses are majority, this equality reflects to the general results. Here, the race distribution by academic degree, and here the gender distribution by course. We can note that again the teaching is the more equal group, and I can go to some concluding remarks. The first one is that we have a stability in the proportion of female incoming students, and a decline in the proportion of female graduates, what we can see in the first bar plot I showed. And over the years, we don't have big changes in the results. We see a very similar behavior over the years. And the bachelor courses have more female underrepresentation than the teaching courses. It's interesting also to note that because the statistics and applied mathematical courses, among the ones we are analyzing, they have higher prestige, like professional careers, like we can get higher salaries, for example. So the female participation is smaller for these courses and is higher for the courses focused on care and education. Then regarding the Black racial category, we observed some lower levels of participation when compared to overall proportion of women in the analyzed courses, and the white racial category is the majority when we compare the classes without looking at the unknown and not declared information. To finish, I'd like to thank you for your attention, or in Portuguese, muito obrigada. Also, I put here the reference about this work. As I said, it's a group work from the 3 Brazilian societies related with mathematics and statistics. I also put a QR code for those who are watching on the computer and can scan this. And for the others, I can put the reference in our chat. Thank you again.
Thank you, Renata, for your presentation. Are there any questions? I think we have a couple of minutes. Well, I have one comment, actually a question for Renata also. I am very familiar with this data. So it's data about all undergraduate students in Brazil. So it's a huge data set. And in Brazil, we have, I am sorry.
I'm trying to...
We have undergraduate courses of statistics, so a major in statistics. And we have noticed that the number of women entering these courses are decreasing over time, which is different from what we expected. So my question to Renata is, why do you think, or why is this happening?
Mm-hmm. Actually, it's something we have discussed among the people in the working group. And what we think is very related with this, one of the statements of my concluding remarks here, which is that these courses, they have higher perspectives for the professional career. And when it happens, the men start to get interested about these courses and go and apply to them. So maybe this is one possible reason. Also, these courses, we don't have the teaching option for these courses, so they are not the ones related to care, and like I said here, care and education. So this pattern that happens with these courses are very different from the statistics. I can resume saying the data science is getting the statistics very popular and making men get more attracted by this field.
Okay, thank you, Renata, for your presentation. Let's move on to the next one. The next speaker is Agatha Rodrigues. She's an assistant professor at Federal University of Espirito Santo, and her research areas are survival analysis, biostatistics, and machine learning. Agatha is the principal investigator of the Brazilian Obstetric Observatory and they analyze public data sets related to pregnant and postpartum population to support public policies in Brazil. This project was granted by Bill and Melinda Gates Foundation. She's also the coordinator of the data science laboratory at the same university, and she is a co-founder of the Victoria chapter of Our Ladies. I don't know if you know what Our Ladies is, but it's a global community dedicated to promoting gender diversity in data science in our programming. Agatha.
Hello.
You can share your screen and.
Okay. Hi everyone. Can you hear me?
Yes, we can hear you.
Okay. So thank you very much, Gisela, for the kind presentation. So as Gisela said, I am Agatha. I'm assistant professor in the Department of Statistics at the Federal University of Espirito Santo. And I'm also the principal investigator of the project Brazilian Obstetric Observatory, the OBR. So first of all, it's a pleasure for me to be here, and I'd like to thank Gisela for the invitation. And I will start my presentation talking about some cases in which our project has contributed to understand the scenario of pregnant and postpartum population in Brazil, and how it also contributed to make public policy decisions for this population based on data. So firstly, I would like to introduce the Brazilian Obstetric Observatory, the OBR. The OBR is an interactive platform for monitoring, analyzing public data, and disseminating relevant information in the area of maternal and child health. Here, when I say maternal population, I mean pregnant and postpartum population. And this project consists of a multidisciplinary team with researchers in statistics, data science, obstetricians, pediatricians, among other professionals. The OBR studies are inserted in the Sustainable Development Goals, SDG 3, which is related to good health and well-being, and specifically discussing actions to reduce maternal mortality. So one indicator that we can monitor to understand the maternal mortality of a location in a specific period of time is the maternal mortality ratio, MMR. The MMR is calculated by the number of deaths due to causes related to pregnancy, childbirth, and postpartum period per 100,000 live births. Brazil has committed to the target of reducing the MMR to 30 maternal deaths per 100,000 live births by the year 2030. But unfortunately, we are far from this target, as we can see in the next slide. So in this graph on the right, we have the MMR per year from 1996 to 2021. We can observe that throughout this period, we have consistently been far from the goal of reaching a maximum of 30 deaths. The lowest MMR was observed in 2019, the year before the COVID-19 pandemic, and the year 2021 was the most critical, with the MMR doubling compared to the pre-pandemic level, reaching MMR levels from 20 years ago. As we can note, the COVID-19 has led to a significant increase in MMR in Brazil. And here I present Brazil's map. These maps represent the MMR from Brazil state in 2020 on the left, and the year 2021 on the right. The darker the color, the higher the MMR. And we can observe that for both years, states in the north and the northwest regions have the highest MMR. Although the MMR has increased for all the states when comparing 2021 to 2020, this increase is more critical in the northern states in Brazil. And a particular concerning highlight is the state of Roraima, this state here in the top. And this is the Amazon region in Brazil. Roraima has the more than 300 maternal deaths per 100,000 live births, which is a very worrying number. Besides, these maps show us how unequal the situation in Brazil is. In this graph, I present the percentage of maternal death in purple, and you also have the percentage of pregnant in yellow by educational level. So you have elementary school, high school, and the higher school here. While the maternal population with elementary school represents 22% of the total population, maternal death within this educational group account for nearly 46% of the total death recorded from 2010 to 2021. This analysis indicates that poor women are more susceptible to dying during pregnancy, and one reason is that this population has limited access to adequate prenatal care. We raised awareness about this data by engaging in conversation with journalists from different media in Brazil and highlighting these alarming statistics. And for example, the new article says that Brazil needs to invest in actions to reduce maternal mortality by 2030. And besides, the OBR studies also had repercussions in public policies. And as an example, the president of National Health Council has implemented a series of measures based on data from our project to guide the Ministry of Health in their efforts to combat maternal mortality. And one thing that I would like to talk more, another case that I would like to present now is related to the situation of the maternal population during the COVID-19 pandemic. This study that I present now was funded by Bill and Melinda Gates Foundation and by FAPES and CNPq. These last two are agencies from Brazil. And the OOBR started at the February of 2021 to monitor the maternal situation during the pandemic by analyzing public data sets on hospitalizations of pregnant and postpartum women. We observed that the pandemic scenario was getting worse, and at that moment, this population was not considered as a group of risk. To illustrate that, we observed an 87% increase in the number of deaths only in the first 4 months of 2021 when compared to the entire year 2020, and a 116% increase in lethality in hospitalization cases. The pandemic in Brazil in that moment was getting more serious for all the population, it's true, but for the maternal one, it was much worse. So the way we, by considering the seriousness of these numbers, we decided to disclose this data, and the way we decided to present these results was by creating and providing an interactive dashboard that to make this data accessible, where users can filter and select the desirable cases and choose variables to make their own tables and graphs. In this way, the idea is that the user can have autonomy to obtain their interest analysis. And with these dashboards, it's really important to say that with these dashboards, we gave visibility to what already exists because they are public data sets. We analyzed the public data sets. But when you provided these dashboards, we did that in an accessible way. At that moment, at the same moment in April, we gave our first interview to a newspaper with great national repercussion to present and to talk about our worrying findings about the situation of maternal population during the pandemic. And after this first one, we gave many other interviews to national and international media. And this task of communicating the findings was neither easy nor simple. It's really hard for us to talk to journalists, to give interviews, but it was really necessary at that moment. Besides journalists, the dashboard has other users. I'd like to highlight women's rights organizations and the state and municipal stakeholders that use the data that they obtained from the dashboard to understand the situation in their city or state. And here it's really important to say that many stakeholders from different places in Brazil, from really very small cities in Brazil, they didn't have tools to visualize and access their own data until then. In a study in collaboration with Crioula is an NGO dedicated to the struggle for the rights of Black women. We observed that the chance of death due to COVID-19 of a Black woman is 72% higher compared to the chance of a white woman. And what else do we do to disseminate our studies results and combat misinformation for this population? We also have the OOBR Instagram, Twitter, and a weekly newsletter to update the news from our project findings and dissemination. A question that arises is why this results dissemination was so important in that moment in Brazil. It's really important to think about that. Here I list 3 points. The first one, as I said before, the maternal population was not considered as a group of risky group for COVID-19. So they don't have priority for vaccination, for example. A second point is that unfortunately, Brazil didn't learn the lessons from the H1N1 pandemic, where many pregnant women died. And the third point is that population was this population, pregnant and postpartum women, was neglected by the Brazilian government at that time. And all these repercussions contributed to society to understand of the serious scenario of the pandemic for the maternal population, exerting pressure on policymakers and also supporting decision makers in public policies. Only 2 days after our first interview, the health minister presented initiatives to support maternal health. In May 2021, we had the law that guarantees home office for pregnant workers. And also in May, fortunately, the vaccination of the maternal population started. The OBR data supported the discussion to include pregnant and postpartum women in the priority group for vaccination. And once we started the vaccination for the pregnant and postpartum women, we also started to monitor vaccination data for the maternal population. We published the effectiveness of the COVID-19 vaccine for this population, and these results also had great repercussions in newspapers and TV news, and reinforced the importance of vaccination for the maternal population. So, after all the struggle, vaccination of the maternal population began, as I said before, in May 2021. And if it had gone according to the government initial plans, this population would only have been vaccinated based on age around September 2021. So the question that I let here is, how many women's lives were saved through the public policy of considering the maternal population as a priority group for vaccination? Despite the disclosing these results, we didn't forget the scientific production. So far, we have published 12 papers in journals with good scientific impact. Another achievement that I'd like to highlight here is that the OBR was cited by the World Health Organization questions and answers about COVID-19 vaccines and pregnancy. Our project also received an honorary award in defense of maternal population during the pandemic from the Legislative Assembly of the State of Rio de Janeiro. And another thing that's really a pleasure for us to say is that OBR published a book with UNFPA Brazil named Maternal Health and COVID-19 Overview, Lessons Learned, and Recommendations for Public Policies. Finishing my presentation here, I would like to bring some thoughts. In Brazil, only 17% of Brazil's legislators are women. Do the vast majority of white men lawmakers in Brazilian Congress spontaneously concern themselves with human rights? My personal answer to this question is no. So because of this, initiatives like this are essential. They are important and they are essential, in my opinion. So this is the great OBR multidisciplinary team that I'm very happy to be part of. Here you can access the OBR platform, you can read the QR code and social medias. So thank you very much for your attention.
Thank you, Agatha, for your presentation. Well, we have some time, so are there any questions? You are welcome to use the Q&A feature here in Zoom.
Okay.
Well, I have a question since there are no questions. What are the challenges you have in achieving results regarding information dissemination? I mean,
yeah, for us, I think for me, in special for me, I think the most challenge was to talk to journalists, to give interviews and to talk about numbers, about statistics to the general society. For example, I am a assistant professor, as I said before, so I'm really used to go to conferences and to talk about my work, to my peers and talk to them about and to use like scientific language. But when you have to talk to journalists, to give interviews, and you have to talk to the general population, you need to use more a different kind of language, because of course I can go and give an interview and just talk about numbers. It's really important to translate the numbers to in a more general language that people can understand. So for me, I think the most challenge was to talk to journalists, to transmit my research results to the society. For me, it's the biggest challenge.
okay, thank you very much, Agatha.
Thank you very much.
So now we move on to our last speaker, Vanessa Leotti. I'm not sure if I pronounced it correctly, her name. She's a statistician and she has a master and PhD degree in epidemiology. She's a professor in the Department of Statistics in the University of Rio Grande do Sul, which is also in the south part of Brazil. And her area of research is biostatistics. She brings today their experience on a very interesting project called MaEs das Gurias, which I don't know how to translate to English exactly, but hopefully she will tell us about this project now. Vanessa.
Yes, Gisela, thank you. I'm going to share my screen. Let me see. Is everything okay?
Yes, we can see.
Okay. So thank you again, Gisela, very much for the invitation and everyone involved in this, in the organization of this event. I'm here representing 47 people of the MaEs das Gurias project. First, I feel that it should be interesting to try to ask the question, who am I? So that everyone can know my place of speech. I'm a bachelor in statistics and professor at Federal University of Rio Grande do Sul, as Gisela said, both in the statistics department and in the graduate program of epidemiology. I'm a white woman of 39 years, and I'm divorced and don't have children. Also, I like to say that one of the words that represents a large part of myself today is that I am a feminist. So, I am here to present the MaEs das Gurias project. And for that, first, I need to explain its name. MaEs stands in Portuguese for the first two letters of mathematics and the first two letters of statistics. Also, it forms a word that is very similar to the word mothers in Portuguese. Das Gurias can be translated for of the girls, but using the word gurias, that is mainly used in our state in Brazil, that is Rio Grande do Sul. We also thought that this name represents both the present female mathematicians and statisticians and the future ones, that would be symbolically our daughters. The project begins in the end of 2021 with trying to obtain funding for organizing an event about women in science and failing. Like a snowball, names to organize the project were being suggested, and it became clear that we had similar experiences and that it would be nice to get together and plan and do other plans. Soon we had students and staff of 7 higher education institutions from our state that are listed here. Since we did not get the funding, we planned an extended event that would have the duration of 9 months to mimic a pregnancy, having online meetings about and for women in sciences. These meetings were transmitted live through YouTube every 2 weeks. The first one occurred on 11 February of 2022, which is the International Day of Women and Girls in Science. Every month had a different thematic. The problem exists and we need to face it as an introduction, because many of us did not know the scientific research that is currently being done about gender bias in academia. Our problems and how we are seen, mainly to discuss how women are perceived by others in academia, intersections between gender and race, so that we could discuss how the problem is more severe for Black women. Examples matter, to discuss 2 movies about female mathematicians, obstacles we need to overcome, to talk about harassment and other violences, motherhood, to discuss the specific challenges of mothers and how it impacts studies and productivity, expanding our horizons when we talked about aesthetic pressure and also about sexuality, professional lives of women in mathematics and statistics, when we focused on knowing some women outside academia and how they have built their careers, and the birth of a new network. In the last month, our students shared their experiences, and we had a last meeting celebrating the bond that was formed. Some important messages and concepts were presented to us, and I chose some of them to share with you. Lots of data were presented, like in this example, where the invited researcher Gabriela Silva shows that the percentage of scholarships provided to women decreased as higher the importance of the scholarship. We also learned the concepts of horizontal and vertical segregations. The horizontal one happens like in the situation of the scholarships, when we have fewer women than men in positions of power or more prominent ones. The vertical one happens when we have fewer women than men in the same level, like fewer female students in STEM areas, like Renata showed to us later. Glass ceiling is one of the explanations for vertical segregation, where women can see the top of their careers, and it seems achievable, but they cannot reach it. Crystal labyrinth is the constant, invisible obstacles that women face to advance in STEM careers and others that cause, in some situations, the withdrawing of their careers. Another interesting concept that was presented was the survival strategy called dribbling the pain, that some women use to pursue a scientific career without addressing the root problem, like thinking, for example, that only incompetent women should complain about gender bias. Also, we learn about implicit bias, that is defined in neuroscience as the information that is automatically activated and guide our perceptions, feelings, and actions. Here I have the moment where Letícia de Oliveira, a neuroscientist, is giving an example of the implicit gender stereotype when she showed two Google searches for images, one with the word nursing and only female workers appeared, and another with the word engineering, where only men workers appeared. We talked about invisibilization and silencing that was historically used to diminish women participation, and it was more severe for Black women. We have here Ana Maria Luz and Jocelyn Fernandes talking about the movie Hidden Figures that portrays the important contributions of the Black mathematicians Katherine Johnson, Dorothy Vaughan, and Mary Jackson to NASA. We also talked about the difference between types of harassment and other violences. More than one of the speakers talked about the family versus work conflict that many women face in academia that can cause women to choose to delay motherhood, and it's not severe for men in general. One very hard concept that we were exposed to is the internalized sexism that is composed by self-inflicted oppressive practice, like hating our own appearances. Several other topics were discussed. Mental health appeared repeatedly, both from the speakers and the attendees, when they share their experiences. So in our lives, there are lots of cry from everyone. We also discussed about inclusion in education, difference between gender and sex, and about sexual orientation and its repercussions in academia. So we covered a lot more biases than gender bias. I would say that our greatest achievements at the end of 9 months were interacting with other Brazilian groups, like the Committee of Women in Society of Applied and Computational Mathematics, the Parenting Science Movement, and others. Also, we experienced that knowledge is power, because we learned to name what was felt but was invisible. But I think knowing each other, sharing our painful experiences, and starting friendships was the greatest achievement of all. To summarize, I would say that it takes a village to face the challenges in academia, and we found ours. I encourage all of you to try to find yours too. So please, if you like the project, follow us in Instagram and YouTube. Unfortunately, at the moment, all the material is only in Portuguese. In the next week, next Monday and Tuesday, we will have our first in-person meeting in Porto Alegre. If you are nearby, please join us. And feel free to contact me by email or follow me in Instagram, that it's here. Thank you very much.
Thank you, Vanessa, for sharing with us this experience. We have time, so everyone can send questions if you wish. And I have a question for Vanessa that many people that are not really or maybe do not agree with this movement of women in science, they keep asking me. And the question is, what are the main reasons why we need to work towards a science without gender bias? Why is it so important to have women there?
Thank you for this question, Gisela. Many of our speakers in MaEs talked about this. I would summarize in 2 reasons. First of all, for justice, because it is not acceptable that half of the population cannot direct something as important as science is to society. So we need to participate and we need to be able to have prominent positions and to run things. Second, because diverse science is more efficient, solve more problems. This is also true for industries, for companies, and there are studies that show that if you have more diverse staff, you are able to have more creative solutions. So I would summarize in these 2 aspects.
Very good. Thank you very much. I don't see any other questions. So I'd like to thank Renata, Agatha, and Vanessa for their presentation, and also to thank again the organizing committee for the invitation for this session. Thank you very much.